All right, so the late night email reminding you that the essay is due in the morning, the forgotten school lunch, the alarm clock that didn't go off, and the full-on meltdown that kept you and your child home for the morning. That's a regular school day for many families. Things are going to happen, but with awareness and a process in place, you can greatly reduce the anxiety and stress. Genesis Medical Group has counseling, treatment, and even medications when necessary to help. They also handle health issues for the entire family, from pediatrics to geriatrics, and specialists in everything from oncology to weight management. Dr. Crystal Broussard is a primary care family medicine physician, and Erin Sahaleh is a nurse practitioner. Good morning.
Good morning.
All right. Yes, this time of year, so many parents breathe that sigh of relief at summertime. It was just like a break from the whole schedule and getting them out of bed and waking them up and the whole bit. We remember this both as students and as parents.
Absolutely.
Right?
It's supposed to be so exciting.
Yeah. And it can be exciting,
Yep.
but it also brings on a whole nother level of stress. Academic pressure. You were obviously a good student.
Yes.
Think
Well,
back
we
to
were
when-
talking
yeah,
about this.
yeah.
We could go to any college we wanted to. We just had to apply. We applied on our own.
Yeah.
Now it's so difficult. Like, they have to start applying 2 years ahead of time. You have to have basically a college degree to get into college.
Yeah.
There's so much pressure now. It's so completely different than when we were going to school.
Yeah, and Erin, there's the social challenges today that are so completely different. Part of that, I think, because the social media has exacerbated that. But share with us what you went through that kind of feeds into what you do today.
So when I, as far back as I can remember, I had a lot of issues in school with how I was treated, how people perceived me, identity issues. And
those identity issues go across the board, because when you
Yes.
look at your racial ethnic background, you are like a good gumbo, right?
it's true. I mean, I had people call me names on the bus and I didn't know what it meant. I had to go to my dad and say, what did this mean? And it was a racial slur and I just didn't understand.
Give us your background.
So my father is from Ethiopia and my mother is she's from New Jersey, so I'm mixed, biracial. And it was, I'll remember to this day, that day, they said to me, somebody called me an Oreo.
Yeah.
And I didn't know what that meant. And I went to my dad and I was like, what does that mean?
Yeah.
And he knew, obviously, and it was tough.
Yeah.
I mean, and it boils down to some of the things that we even focus on, right? Obesity is a big issue that we face that messes with how kids feel and how things are perceived. It goes really deep into so many different places with kids, because it's not just race or obesity, it's the pressure from home that they
and
get.
sexual identity today, all of that
Absolutely.
as well. All right, anxiety on its face has its place in our minds, doesn't it?
Yes, it does. Well, and again, we get to a point where the kids don't want to go to school. They're so anxious. They fake illnesses. They literally don't want to get out of bed.
Yeah, that's when stuff has gone overboard. Because
Absolutely.
again, anxiety is kind of innate in us, right? So it helps you to
Absolutely.
stay alert in key situations.
Yes.
But when it gets to the point where it's disruptive in your life, sadness, withdrawal, sleep issues, refusing to go to school, as you said, those made-up illnesses, as we
Yes,
oftentimes
yes.
hear. How many times do you uncover that in the office where you say, your child's fine?
Very
but-
often, because we get these children in once or twice a week and they have the same type of symptoms, and it's really anxiety. They're just so anxious about going to school or the expectations about what happens at school.
Yeah, mental health issues are something that we oftentimes associate with adults later in life.
Yeah.
And sometimes that's where a lot of that stuff is much harder to undo because it wasn't addressed earlier on. So you want to interrupt those patterns early.
Absolutely, and we want to catch things like attention issues early on and treat while the kids are still wanting to learn. That's the key. They get to a certain point where they don't want to learn anymore because it's too much to go to school.
Yeah,
we want
yeah.
to intervene earlier than that.
And what's nice about you all, as I mentioned earlier, Genesis, you all address the entire family, because oftentimes, as they always say, it takes a village, right? But you can't just help that child, you have to help the entire family as a
Absolutely.
unit, because everybody's feeding into each other. All right, interventions. The first intervention probably needs to be a proper diagnosis of what's really going on.
Absolutely. And proper diagnosis, and then also addressing, as you said, with the entire family.
Yeah.
It's very important.
All right, because that proper diagnosis can be, do we have for lack of a better term, a biological reason for something happening versus it's emotional and external in terms of the environment
Absolutely.
they're in?
And we do full physical assessment prior to doing any type of treatment, any type of diagnosis. Absolutely.
And then when it comes to the counseling, what do we start with?
So when I have a patient that comes in and with the parent or whatever, and they present their concern, I start with trying to break it all down. what exactly is going on, because to the point you guys were just talking about, a lot of times patients present thinking that it's depression or that it's anxiety, when actually that could be untreated ADHD, and it's not, you know, those three different things. So it starts with getting a complete history, and I spend an hour with all my new patients, and that's why I take the longest, because I have to really figure out what's going on and hear every aspect.
Yeah, ADHD, and then there's ADD, which you were saying oftentimes is uncovered later because that child is not fidgeting in their chair and moving around and being disruptive. That child appears to be paying attention, but it doesn't show up on tests and grades at times.
Absolutely, and I mentioned it's sometimes the smartest kids because they've been able to kind of fake it until they get to a certain point, and then they start getting behind, and again it starts causing anxiety.
Yeah.
So we see it a lot of times, it's just anxiety.
And sometimes there's just some things that you can do in the household to get rid of some of that anxiety and some of that angst, and some of the protocols and expectations. Pre-prepping for the day, I cannot tell you what a difference it made with my son getting out of the door when he picked out his clothes the night before, and I'm like, is it clean? We don't want to discover you need to wash it that morning. It's not going to get dry in time, right?
Absolutely.
So he has to lay it out, actually set aside a separate drawer. This is the drawer for tomorrow's clothing, right?
Yes.
The matching shoes, all the stuff that you need. Pre-pack the lunch the day before.
Absolutely. Everything that you can do to prevent meltdowns in the morning time. As much prep as possible in the morning so that literally your kiddo gets up, brushes his teeth, eats breakfast, puts clothes on, and out the door.
Yeah, and then expectations later in the day is, no, we're doing homework now, not later, right?
Yes, and winding down, and I tell people a lot of times what I want them to do with their kids is pick a time when electronics are turned off, because also this feeds into their sleep.
Yeah.
And why kids, you know, are so tired in the morning because they were up on their phone or their iPad or whatever it is. So I say, you know, you got to take it away and then resume in the morning.
All right, medication. I know there are a lot of people who say, absolutely not, I will not put my child on medication. And then there are people who know that it has been life-changing for them, for their child to be able not to behave in the classroom, but be able to get the best out of their education and themselves, right?
Absolutely.
So the key is making sure it's the right dosage and the right medication.
Right diagnosis, right dose, right medicine, not having side effects that they can't tolerate, and follow up. So we see so many kids, or actually adults too, put on medication for behavioral health and then they're never seen again. And so it's important to have that follow up and the therapy and talking with the whole family, the teachers, like the entire environment.
Yeah, because as you grow, you may need different dosages.
Absolutely.
And also, as you learn to manage and self-manage some things, you might not need the medication for certain things. All right, let me round out with what I said earlier with Genesis Medical Group. This is a concerted effort by doctors to create the best system possible, almost an umbrella system, because you have so many specialties and you can see everyone in the family.
Yes. Yes, and it's so hard to get psychiatric care in our area. We just don't have enough psychiatrists. And so we're really trying to bridge that gap of literally we have a missing hole in our care in the Houston area.
Yeah,
so we're trying to provide that bridge.
So you can take care of that, and while you're there, you can get your physicals done.
Absolutely.
If you, like I mentioned earlier, in oncology, you deal with whatever it is that you have a medical issue with, cardiology, all of it, you all will
All
deal
in
with
one
it.
place and all in one system.
Yeah, and your records stay in one place.
Yes,
Yeah.
yes.
And like I said, it can be a family field trip. Come on, grandma, great-grandma, kids,
Yes.
grandkids, all of you at one
We
time.
actually do a lot of that.
Yeah, right. Get it all done at one time. That's time management. That helps to reduce
Yes, it
anxiety
does.
and stress as well. Well, to book an appointment, call 281-440-5300. Again, that's 281-440-5300, or visit genesisdoctors.com.